Good afternoon. It is a bit of a sensitive subject, HIV. I don't know how many of you are aware about it, but before going to the topic of its sensitivity, stigma, and discrimination, I would like to give you a small introduction about the situation in our country and the world. In our country, the first HIV case was identified in Chennai in the year 1986 amongst the female sex workers. It came from the US to Bombay, then it traveled through the highways to Chennai. And in 1987, out of 135 cases which came to light, by the time, 14 people were already have come to the AIDS stage, that is the end stage. We call it the end life stage. And in 2009, we had 2.395 million people living with HIV, which went up from 2.27 million in 2008. In 1987, the government started establishing the NACO, National AIDS Control Organization. Now it's in Delhi. And then so many other programs to control the epidemic in the country. And the scenario of HIV/AIDS in the country by 2000 declined due to the intervention of NGOs and other state AIDS control societies. And the rate of HIV transmission in Asia were slowing down, and at least 1,000, but in spite of that, 1,000 new infections were among the adults, which was notified by the year 2011. To give you a small statistics, in India, people living with HIV, there are 330 lakhs. And new HIV infections are 27 lakhs. And deaths so far up to 2007, that is the official statistics we have, it's 20 lakhs. And this gives the breakdown of adult and children infected with HIV. In the world, it's about 36 million people. And coming to this slide, the epidemic in India, it has been categorized by NACO as 4 categories. Category A, B, C, D. A is supposed to be the topmost. When we score high marks, they give us A grade. And here, the A grade is given to the districts which have high prevalence. Do we have to be proud about it, or feel sad about it, or feel shame about it? You have to think. The prevalence in our country is 0.34%, and there are 23.1 lakh people living with HIV, out of which 9 lakh are women with HIV. And the whole of the country, 141 districts are A districts. Unfortunately, Coimbatore also comes in category A. I'll come to that statistics of Coimbatore. And this, we have to know about it, because I'll come to the later part of it, you'll understand. And there are B category 46 districts, and C category 309 districts, and D category 114 districts. And the age-wise distribution about HIV, on HIV, and you see that 17,785 AIDS cases reported till June 2007, out of which 31.2% are women and 4% are children. And here the biggest age group is 30 to 49 age group, who have the maximum number of people in that age distribution. Here, when you come to the state of Tamil Nadu, you can see the ANC prevalence, antenatal care prevalence. This is tested among pregnant women who go for tests. It is very difficult to test HIV among the general population. So they have some set parameters by the NACO guidelines or WHO guidelines, and they test among these pregnant women. Out of this, the 0.25% is the prevalence in our state. And the estimated PLHIV is uh, 84 lakhs. And here you see the district colored, the percentage 0 to 0.5 like that. And the highest prevalence are brown in color, shaded 1.5 to 2.25. Because of the different intervention and prevention work among the female sex workers, the MSM, men having sex with men, the homosexual community, the injecting drug users, the transgenders, these are the people who have the high prevalence of HIV, who spread this epidemic with the general population. And because of the interventions of the NGOs, the prevalence have come down drastically from 2001, which had 1.13%. From there, it has come down to 0.25% in 2000 year. But that is not it. It is a very sad state of affair. The last 2 years, the government have changed policy. They have changed the strategies. Because of that, now the trend is in the increasing trend. And here you will see the distribution of prevalence among the high-risk groups. The high-risk group is, we call the commercial sex worker or the female sex workers, and the MSM, the homosexuals. It used to be high among the injecting drug users in India, but now the present trend is the HIV prevalence is very high among the homosexual community. It is a very sorry state of affair. And you can see in the graph, from 5.6, it has gone up to 6.6. And this is going up and up even today. And you should also know about the modes of transmission. Sexually transmitted infection is red, that have the maximum number of percentage. Then it's injecting drug users. Then through blood, when we give blood or when we get blood through an infected person. And perinatal, that is mother to child transmission. Then unidentified, there is another category. We do not know how that comes. Also, I have to tell you that the roots of epidemic in Tamil Nadu, it comes through the highways, especially with the truckers, the lorry drivers mainly. We call it as TIP, Truckers Intervention Program. And they are the main source of carrying the infection from one place to another. From Bombay also it came to Chennai, like that. So Dharmapuri, Salem, Namakkal, and Coimbatore, Trichy, Madurai, these are the places where the prevalence is said as very high. As young people, we conduct a lot of camps and we move a lot with colleges, students to motivate them to donate blood so that many lives could be saved. And many voluntary donations voluntary blood donations are done over the years. And the 82% is done by the voluntary donation by students like you. The blood transfusion, again, it is a mandatory by the government according to the WHO rules. Now they do 5 tests for HIV, HBV, HCV, VDRL, and malaria. All these tests are done when you donate blood. And when they find your blood is carrying HIV virus, immediately they destroy it. Any of these virus is there in the blood, immediately they destroy it. But the problem is when the blood has virus which is within the window period. For example, if I have been infected with HIV today, I will be normal for the next 90 days. It will not be, it cannot be screened in the blood. They cannot identify that that blood carries HIV. So when you donate blood, or somebody with HIV donates blood on day 2, and the blood is again given for a government hospital without waiting for this window period of 90 days, then the virus is transferred. This is also another thing, and that's why the government has now made it very strict and mandatory even for the private blood banks to go through these norms. So you have to be very careful when you give blood or donate blood, or when you or when your relatives need blood, when you buy blood or when you get blood from banks, make sure it's properly tested and crossed through the window period. And coming to the statistics of people living on with HIV and registered with the ART centers. ART centers is attached with every government hospital or every district in the headquarters. So far, about 99,341 people have registered with the ART centers, and out of which 41,677 people are on ART drugs. 8 years back, this ART package of ART drugs cost about 5,000 per person, and now it costs about 800 rupees, which is given free of cost by the government. But there are defaulters, and because of the default, many people die because side effects are there. So our job is to see that the people live in good condition. The main problem here is the women who get infected from the husband dies earlier because of late detection, and the women are detected and they live longer because of early detection, and the treatment is there. But the problem they go through is enormous amount of social issues, family problems, and that is where we talk about stigma and discrimination. Coming back to our district, Coimbatore comes in category A. The prevalence rate is 2.5 among the ANC mothers, and there are 12,545 people infected with HIV/AIDS, out of which 1,721 are on ART drugs. And in this we have categorized as there are female sex workers 2,374. This is 2008 statistics. Now it's around 4,000. Female sex workers are there. They are not doing posh sex work. They are in the street-based or platform-based or brothel-based like. Homosexuals 2013, and the truckers being intervened for HIV prevention is 3,730, and there are around 15,200 migrant workers who've been intervened in the Coimbatore district. This is for your information, and now you see the latest current statistics which is available, and you see in 2008-9 or from 2000 1.63, it has come down drastically, and from 2008-9 it has gone to 0.37. Now it is in the rising trend. It's 0.38, and I am sure it is 40%. 0.40 now. That is the state of situation. And in 2012-13, and the whole country, the whole state, 42,689 female sex workers are covered under the HIV prevention, and around 30,000 on homosexuals, 2,500 transgenders, and 631 injecting drug users. And these are the population we work with, and we have these children who we cater to. I just want you to have a small visual.
Welcome to RUSS Foundation.
Vanakkam. Hello.
We don't use the word orphanage here. We call it home for children without parents, and we have to settle them in life. Imagine a child without a father at a tender age of 10, 11, and we have 19 children without both the parents in our home. We have a small nursery and primary school focusing on child care, HIV-infected children, home-based care, helping them in toilet habits, eating habits, but very few people want to come and do service like this. And we do have a very good team. I am proud to say that they are not orphans. The way they grow up, they're much together.
This is my home.
This is for RUSS Foundation.
This is my family.
I thought you uploaded that I finished. I haven't. Now I'm going to start the subject. I have to tell you about stigma and discrimination. Without having the background information on HIV, no point in talking about stigma and discrimination. It's very important we discuss on this because stigma not only sticks with HIV, but even in our own campus, in our house, in our neighborhood. How we are going to address that? Stigma generally refers to labeling someone as unacceptable or inferior. But when it comes to HIV, it affects more. Immediately, it denotes to something related to sex, which is not true. What a small child who carries an infection from the mother has done, that is the problem. And the problem what we face in our home is a girl child when she attains puberty. That's a big challenge. Stigma appears in many forms, including suspicion, neglect, racism, blame, gossip, isolation, abuse, violence, loss, ridicule, shame, judgment, insult, rejection, and many more. And all this leads to sometimes suicidal tendency. Why stigma is so important in our health? It interferes with our health-seeking behavior, hides the diagnosis, adherence, default for especially on ART drugs, and unsafe sexual practices. Here, I would like to highlight on 3 different types of stigma: public stigma, self-stigma, and institutional stigma. Public stigma on HIV. Somebody knows that somebody has HIV. Are we ready to accept them? What wrong they have done? Why we are neglecting them? Why we are discriminating them? Well, self-stigma, I'm having HIV. Should I go to this restaurant? Can I eat there? Can I sit with them? Will I be discriminated? Will I be accepted? This kind of feeling. I will tell a small incident of one girl who lost her parents, who died because of HIV, both the parents. And now she's doing second year BSc mathematics. The problem started when she attained puberty. And one day when she was waiting to go to her college in the bus shelter, 2 guys at the background was telling this girl has HIV. Overhearing that, this girl developed a suicidal tendency. What wrong she had done? She got the HIV from the mother. And we have saved her life. She has gone to the 3rd year BSc mathematics. And we have given the confidence. Just because somebody is stigmatized, discriminated, or pointed out the negative way, normally you can't spot out somebody, they carry this HIV virus. This is how it is. And we have 45 children. We have staff working with them. There is nothing wrong to eat with them, sit with them, play with them, as long as there is no blood wound or open wound with a blood contact, nothing to be worried. And institutional stigma, again, when an institution say we don't take up HIV children, like that, or we don't accept staff, this is a problem. So we focus on PLHIs, that is people living with HIV, mother living with HIV/AIDS, and homosexual men, TB, patients, and community. There is a testimony which is highlighted from the UNAIDS. My in-laws blame me for their son's death. They have severed all relationship with me. They never discriminated with their son, but to me they say, you also have AIDS. Stay happily wherever you are. I took great care of their son. Never felt dirty cleaning him up, but they always say, you married him and our son got bedridden. I have lost faith in everybody. This is the state of affairs the women face in our society today. So let us continue our community work towards the community and continue our community level interventions turn the negative to positive, combat myths, addressing the needs of specific groups, tailored group-level interventions, combat fear for speaking out, and education support programs aimed at health. Are we ready to take these steps to address stigma related to HIV and eradicate it? I stop discrimination now. Do you? If yes, thank you.